October is Breast Cancer Awareness Month. Breast cancer is the most commonly diagnosed cancer among African American women. Although more white women are diagnosed with breast cancer, black women are 40% more likely to die from it. In Memphis, black women are twice as likely to die as white women from breast cancer. Ours is the highest rate among the 40 largest U.S. cities. Dr. Stephen Edge, the director of the Baptist Cancer Center, joins us to talk about this issue. Dr. Edge, thanks for joining us.
Well, thank you for having me.
Why is this such a critical issue here in Memphis?
Well, I think you said it all. Unfortunately, for reasons some of which we understand and some of which we don't, the death rate for women with breast cancer in Memphis, if you're black, is more than double that than if you're white.
And why the vast difference?
Well, you know, it probably has a lot to do with access to care, insurance coverage, cultural issues that prevent people from seeking out care. There are a lot of issues, and a lot of it has to access to mammography. So there's major efforts ongoing right now looking at trying to improve access to mammography and get mammography for women in need.
I was going to ask about that. How do we do that? How do we get more access?
Well, all the health systems, the Baptist system, the Methodist system, St. Francis, all have programs to help women get mammograms for free. A lot of that's supported by the Susan G. Komen Foundation and the Race for the Cure, which is being held downtown this year on October 31st. And in addition, there's a big public effort now called the Sister Pack Project to get women to be aware of this and try to reach the women who currently aren't getting mammograms.
Is part of the focus on letting women know and really patients across the board how it's not that frightening, just go in and do some preventative care?
Well, I mean, that's true for men and women, that many of us don't like to do that. Heck, I was 57 when I had my first colonoscopy. I had a real scare because I was stupid enough to delay that. But there are many barriers to mammography and cultural barriers that scare people about it. It's easy for you and me to say it doesn't hurt, but it is a little uncomfortable. And but people need to recognize that we really do save lives by doing this.
And you mentioned the Race for the Cure and other events. Is it important for women to get involved in those activities?
It's important for women and men to get involved in those activities. The Race for the Cure does provide the large majority of the funding for free mammograms for women who are in need in Memphis. The American Cancer Society also has their Making Strides for Breast Cancer also in October, another very important event. And it's important for us, our families, to all be involved in these things for our community.
And finally, how can people get in touch with your center?
They can call the Baptist Cancer Center or the Baptist Medical Group through, you know, I'm blocking on the phone number right now, and I bet my folks won't be happy with that.
Well, I'm sure people can Google it easily. Yeah. Dr. Stephen Edge, we appreciate your time here at 4 o'clock.
Thank you very much.